Hi everyone, thank you so much for joining Just What the Doctor Ordered. My name is Dr. Zainab and I'm a GP and I'm very passionate about delivering health information. And today's podcast is on melanoma. May is Melanoma Awareness Month, so I just felt it was so important to reiterate the important points regarding this skin cancer. It's a serious form of skin cancer and it develops from melanocytes. And melanocytes are cells responsible for producing the pigment melanin, and melanin gives us our skin colour. And we know it is less common than other types of skin cancers, but it is more aggressive and it can spread to other parts of the body, including the liver, lung, and bone. So it needs to be identified early and treated early. And we know that the primary risk factor for melanoma is exposure to UV radiation, which is from the sun or tannin beds. Other risk factors can be fair skin, history of sunburns, especially during childhood, presence of moles. So if you have multiple moles or you have lots of moles that have suddenly developed, that can increase your risk as well. Family history of melanoma or other skin cancers can also predispose individuals. Or if you have a weakened immune system, and that can be from medication or conditions that do that. And I always say to patients that make sure that you're always checking your skin, especially the bottom of your feet, and get someone to have a look at your back, because the number of patients that have come in who've got moles on their backs and have not noticed any change in them is quite large. And obviously we don't look at our backs, we don't always look at the bottom of our feet, so it's important to do that. And I say to patients that melanomas don't always arise from existing moles. Usually they're new skin lesions, new moles that have suddenly appeared. But it's also important to look at your current moles and if you notice any changes in those, to see the GP. And in general practice, we have a tool called a dermatoscope. And a dermatoscope is it's almost like a magnifying glass, a glorified one, but very expensive one. And it's really good at looking at the deeper layers of the skin. And we can actually look at hallmarks of melanoma through this piece of equipment. It's absolute genius. And you do need training in it. So if you have a GP that hasn't got training in dermoscopy, then they can refer you to the skin and dermatology clinic to get that mole looked at by someone who is trained. Now, I always say to patients that if you notice a mole or a growth that changes in size, shape, or colour, a mole that is asymmetrical or irregular in shape, it has irregular borders, the mole that is multicoloured or uneven in colour is a red flag. And usually they say a mole larger than 6 millimetres, but I would say that a mole of any size that has all the other hallmarks is suspicious. So I wouldn't say, oh, it has to be more than 6 or 7 millimeters that means it is a melanoma. It doesn't mean that at all. It could be any size. If it has any itching, tenderness, or bleeding within it, that can also be a red flag. Now, in terms of diagnosing melanoma, a physical examination, so going to the GP, and you might meet someone who has a specialist interest in dermatology, has a dermatoscope, and is able to recognise the hallmarks and refer you on, or we would refer you to a specialist at the hospital. And if the lesion is suspicious, then they would take a biopsy, and that's where they take a part of that mole away and have a look at it for laboratory analysis. Now, if melanoma is diagnosed, then they would do further tests to determine the stage of the melanoma and also how far it has spread. And in terms of prevention of melanoma, sun protection is so important. So, using a broad spectrum sunscreen with an SPF of 50 or higher, wearing protective clothing, and seeking shade during peak sun hours. Avoiding tannin beds. I know it's difficult, and they're actually, starting to close down tannin beds across the country. And I do agree with that because the risks of melanoma are just so much more higher if you're just exposing yourself to that kind of radiation. And regularly checking your skin, no matter what your skin color type is, because we know that obviously those who are lighter skinned are more likely to get melanoma. But even if you're darker skinned, you can get melanoma. And I also say check your nails, check under your feet, check your back. And if you do notice any new or changing spots on your skin, including moles or lesions that have the features that I've just mentioned, then please, please, please see the GP. Thank you so much. I hope this little episode has been useful. Please share it if you feel someone would benefit from this knowledge, and see you on the next one.